Okay, so this will be the lecture on the wrist and hand radiographies, looking at the standard views to diagnose this area. So our standard views for the hand is the PA view, lateral view, oblique view. Then occasionally, particularly with our carpal bones and views of individual fingers, they can really what they call cone down or really focus on a certain area with your PA and lateral views of individual areas of the hand here. The wrist views are the PA view, a lateral view, and oblique view. AP views with ulnar deviation or radial deviation in selected cases. In some cases, you'll have a scaphoid or navicular view if you suspect any type of avascular necrosis or scaphoid fracture. And there's also a carpal tunnel view that they use occasionally to analyze the spaces in the carpal tunnel. So primarily in the wrist, we're going to be looking at the PA, a lateral, and possibly some oblique. And same thing for the hand. So just really those three standard views are the primary ones you'll see in most imaging studies. So we look at the PA view. Like I say, it's just the hand palm down on the film plate. So it gives you a good area to look at the distal radius, distal ulna. You should be able to pick out most of the carpal bones, your metacarpals and phalanges, and associated joint spaces and soft tissues around that area. So primarily, we're going to do this view if we're looking for fractures, arthritis, or any type of degenerative changes, or any focal dislocations or lesions of the bone. So here you see the PA view. Like I say, you can see all the phalanges. You can see the metacarpals. You can see the carpal bones here and how they're aligned pretty well, and the distal ulna, distal radius. So you can kind of see a pretty good view like the scaphoid here. So you can get a pretty good idea of what's going on with the hand here. And they're telling you up here in the plate that this is the left hand. So lateral view, kind of two ways to look at the lateral view. You can do this standard with the arm straight here, or they may put them on a block to get a lateral view of each of the phalanges here. So this is one type of view you can get versus this one. Either way, we're really looking for the alignment of the radiocarpal joints, radial ulnar joints, or any fractures, dislocations. So here's a picture of the block they use for that view to separate the fingers. So the oblique view here, like I say, here we're also looking at an oblique to primarily look more at carpal bones here. It changes the orientation of the carpal bones so you can get a better picture of some of the more central part of the carpal bones, and really looking for fractures primarily with this view. If we look at a PA view of just the wrist, this one you're really looking for carpal bones. You can see various parts of the distal radius and ulna, more proximal parts of the metacarpal bones. But we're primarily focusing, like I say, on these carpal bones, looking for fractures and any type of arthritis or lesion that may be going on with the carpal bones here. So as we look at the PA here of the wrist, really want to look at these lines here. So you should see a nice joint line here. You should see a nice joint line here with a little matching separation here. So you see the hamate, lunate, and triquetrum scaphoid. So you should see these lines are nice and smooth with space in between lines 2 and 3 here. So here's like I say, the arcs again. If we see a dislocation, you may see an overlap of some of these bones. You may see a change in orientation of these pictures here. So here you see a disrupted arc here, and you see a disrupted arc 2 and 3 with an overlap of the capitate and scaphoid, indicating that there's been a dislocation here. So these let's say the main thing is get used to looking at these arcs and make sure they're symmetrical and that they're not interrupted in any way. Then you have a lateral view, really looking for any type of radiocarpal malalignment here. In this space here, you should see that this all sits down in this nice little groove here. Got a nice convex on concave relationship here. So if you do see a dislocation of the more possibly the lunate, you may look for instability of the wrist in those cases. Then the oblique view, let's say it's sitting at a 45-degree angle. The beam is shot straight down through the wrist onto the plate underneath the hand here. And we're really looking for more the trapezium, the scaphoid, and the first carpal metacarpal joint here. So any type of arthritis or scaphoid fracture will be more evident on this. So you can get a better view of the scaphoid and any type of this first joint here between the carpal and metacarpal here. So it kind of gives you a more specialty view of that joint. You can also put them in ulnar deviation to get a better view and really open up that scaphoid in this case. So you can see any type of fractures, avascular necrosis that we may be looking for in this bone. So this is a really good view for scaphoid fractures primarily. As you see, the beam is shot straight down through with the ulnar deviation of the wrist. And here in this view, they really looked at and they can see the fracture line through the scaphoid here, indicating a fracture. So this is the type of view that you'd be looking at to really analyze this type of fracture. And then lastly, we have the carpal tunnel view of the wrist. So they put a little band around the hand, pull it back into full extension here, and you shoot a beam about 15 degrees from the perpendicular here in through the carpal tunnel onto the plate that's underneath the wrist here. So you kind of see this nice carpal tunnel area here that you can analyze, particularly if you think of any fractures like hook of the hamate you can see with these, and carpal tunnel syndrome. If you suspect there's an impingement in this tunnel area, you can utilize this view. Like I say, it's not one that you see a lot of these days, but it's something that you can use if you suspect some of these pisiform or hamate type injuries. All right, so that sums up the upper extremity for the standard radiography. So if you have any questions on that, feel free to give us an email or let us know what questions you have, and we'll be glad to answer those. In our time together, we'll be covering more pathology and looking at more MRI.